Hey nurses and future nurses, Kayla here from Education RN. Anyone else find it hard to learn all about medications? Well, we are here to make it simple. Let's talk Metoprolol. Metoprolol is a beta blocker, which means it LOLs. Well, I'm kidding, but it is an easy way to identify the other beta blockers. It is used for angina, also called chest pain, heart failure, myocardial infarctions, atrial rhythm changes, and high blood pressure. It works by blocking the beta-1 receptors to decrease cardiac output by making the heart contraction weaker and slows the heart rate. The top side effects to think about are heart failure exacerbation, slow heart rate, low blood pressure, and heart block. Remember, if the medication works too well, you will have an exaggerated version of the desired effect. Also, there are beta receptors in the lungs, so we have to worry about bronchospasms. If the blood pressure drops too much, we will have symptoms of low blood pressure, like dizziness. It can also hide the signs and symptoms of hypoglycemia, so be careful of our diabetic patients. The medication can be given orally or IV. Typically, the first IV dose is a big deal, and the patient should be on a cardiac monitor with a provider nearby. Since it lowers the blood pressure and heart rate, check them within 30 minutes of giving the med and hold if they're low. Do not give this med to someone who has sick sinus syndrome or second or third degree heart blocks. We don't want to block it anymore. We need to be very careful of our patients whose heart rates and blood pressures are low or get low, or if they have any respiratory condition already, like COPD and asthma. Make sure your patients know not to stop this medication abruptly. The heart rate gets used to it, and stopping it abruptly can change the heart rhythm. Also, because of the potential for serious adverse effects, any side effects should be reported right away. Now, what are you most likely to be tested on? I got you covered. Metoprolol is a commonly tested medication because it's a commonly prescribed medication. You should know the indications, be aware of the effects on the blood pressure and heart rate, and to assess the blood pressure and heart rate before you give it, possibly after too. You should also know to be careful with patients who have asthma or COPD because of the risk of bronchospasm. Good luck, future nurses, and remember, learn it to really know it.